Right now, the government and insurance companies are sitting on billions of dollars that belong to you, money you paid through decades of hard work, and they are counting on you never asking for it back. If you have ever felt like Medicare is taking everything and giving you almost nothing in return, you need to watch this entire video, because I am about to show you exactly how to get every single dollar and every single benefit that is rightfully yours. Most people have no idea what they are leaving on the table, and by the end of this video, you will not be one of those people. You have paid an enormous amount of money into this system. Over the decades, through every paycheck, through your FICA taxes on your W-2, whether you worked for 30 years, 40 years, or 50 years, you paid into Medicare and Social Security without missing a single payment. FICA includes a Social Security tax of 6.2% and a Medicare tax of 1.45%. Your employer paid the other matching 1.45% on the Medicare side. If you made higher income, you paid an additional surtax of nearly 1% on top of that. So for your entire working career, money was pulled from your paycheck every single pay period and sent to the government specifically for Medicare. You would think after paying into the system for that long, Medicare would be completely free when you finally reach eligibility. But here is what shocks people. When you start Medicare, you still have to pay a monthly Part B premium. Right now, people are paying a significant premium every single month for Medicare coverage they already paid for over their entire career. And it gets worse. If you happen to have higher income a couple of years ago, you are paying an IRMAA surcharge on top of that. We are talking an extra $100, $200, $300, or even $400 every month added to your premium. Then you also have to pay for Part D prescription drug coverage separately. And here is the part that really gets people. Medicare is also funded by general tax revenue. Regular income taxes that you pay every year also go toward funding Medicare. So let us add this up. You paid payroll taxes for decades. You pay a monthly Part B premium now. You pay IRMAA surcharges if you had higher income. You pay for Part D. And your regular income taxes also fund the program. You are paying into Medicare from every possible direction. So it is absolutely critical that you get every single benefit you are entitled to receive from this system you have funded your entire life. Now here is something that happened recently that you need to know about. The government announced a few months ago that they were not going to give Medicare insurance companies additional funding increases. But then the lobbyists showed up in Washington, D.C. They had their fancy dinners, they had their meetings, and suddenly the government reversed course and decided to hand over several billion dollars in additional funding to these insurance companies. We are talking about $13 billion. Let me be very clear about something. That is not the government's money. That is not the insurance company's money. That is your money. You paid it. And do you think these insurance companies are going to take that $13 billion and pass it directly to you in the form of better benefits and lower costs? Absolutely not. They will not do that unless you know what you are entitled to and you fight for every dollar. That is exactly what we are going to cover today. I have put together a complete guide based on decades of experience working inside the system. I am going to walk through everything you need to know to maximize your Medicare benefits and get every dollar back that you deserve. You can save this information, print it out, put it on your refrigerator, share it with friends, bring it to your senior center. This is information that everyone on Medicare needs to have. First, let me explain something that confuses a lot of people about Medicare Advantage plans. A lot of people say they do not pay anything for their Medicare plan because they have a Medicare Advantage plan with a $0 monthly premium. They think the insurance company is giving them all these wonderful benefits like gym memberships, grocery cards, hearing aids, and glasses completely for free out of the goodness of their heart. They think this company must be the most generous organization in the world. But that is not how this works at all. These are for-profit companies, and they are making money off of you. Here is how it actually works. When you sign up for a Medicare Advantage plan, that insurance company goes to the government with their hand out and says, "We just enrolled this person, now pay us money every single month for them." And the government does exactly that. They send that company a check every single month for you. So while you might pay zero in monthly premiums directly, the company is receiving your taxpayer money from the government every month. The formula for how much they receive is incredibly complicated, but here are the general numbers. If you are a relatively healthy person living in a less expensive part of the country, your Medicare Advantage plan is probably receiving somewhere around $500 to $700 per month for you. So you are not paying zero. You are effectively paying $500 to $700 a month. That is your money being handed to them. If you have multiple health conditions and live in a more expensive area, they are receiving $1,500 to $2,000 per month. In the most extreme cases, for very sick individuals in very expensive parts of the country, I have seen companies receiving over $2,300 to $2,500 per month per member. This creates a terrible incentive in the system. It actually benefits these companies financially to document you as being sicker than you might be, because the sicker you appear on paper, the more money they get from the government. And at the same time, they want to limit your access to care so they can keep more of that money as profit. You are paying for all of this. You are paying hundreds or thousands of dollars every month, whether you realize it or not. So let us make absolutely sure you are getting everything you are eligible for. Let us talk about prescription drugs first, because this is where many people lose the most money. This year, there is a Part D out-of-pocket cap of $2,100. That is the maximum you will spend on prescription drugs for the entire year. But here is what most people do not realize. Your Medicare Advantage plan includes a Part D prescription drug plan, and that plan has a formulary, which is basically their approved list of medications. They tell you, here is what we cover, take it or leave it. But you do not have to just accept that. If there is a particular medication that works for you but is not on their formulary, or if they want you to take a generic or alternative that does not work well for you, you can request a formulary exception. This is your right, and many people do not know it exists. You can also look into 90-day mail order options for your prescriptions, which can often save you significant money compared to monthly pharmacy fills. There is a brand new feature this year that is incredibly important, and it is called smoothing. Here is the problem it solves. Some people have very expensive medications, and they hit that $2,100 cap in January or February alone. So while it is great that there is a cap, coming up with $2,100 in the first month or two of the year is extremely difficult for people on fixed incomes. Smoothing takes that $2,100 maximum and distributes it evenly across all 12 months of the year. Instead of paying everything upfront at the beginning of the year, you pay a manageable amount each month. This program existed last year, but you had to specifically opt into it. This year, it is completely automatic. You do not have to sign up or request it. It just happens. If you have expensive medications, this is going to make a significant difference in your monthly budget. Another major program that too many people miss is called Extra Help with Prescription Drug Costs. You get this through the Social Security Administration. If you or someone you know is struggling to pay for medications, contact Social Security and tell them you want to apply for Extra Help. They will know exactly what you are talking about. This is one of the simplest applications in the entire Social Security system. It does not take long. It is not complicated, and it can save you a tremendous amount of money on prescription drugs. Far too many people who are eligible for this program never apply because they simply do not know it exists. Now let us talk about the use it or lose it reality of Medicare Advantage plans. This is critical for everyone to understand. Medicare Advantage plans are only good for one calendar year. Period. If someone tells you they have had the same Medicare Advantage plan for 3 or 4 years, that is technically incorrect. They may have had the same company name and the same plan name, but the actual plan itself expires every December 31st at midnight like Cinderella. On January 1st, a brand new plan takes its place. Same company, same name, but all of the details including benefits, costs, networks, and formularies can change completely. This is exactly why you need to review your plan every single year. You do not necessarily have to switch, but you absolutely must review what has changed to determine if your current plan still serves you well. Because these plans only last 12 months, whatever benefits your plan includes must be used by December 31st, or they are gone forever. If you have a flex card or a grocery card or any type of benefit allowance card, use it. Some of these cards expire at the end of each month. Some expire quarterly. Some last until the end of the year. Check your specific card and know its rules. You would be absolutely shocked at how many people have these cards and do not even know it. They received something in the mail, thought it was junk or a promotional offer, and threw it in a drawer. They had no idea there was $100 a month on that card for groceries or over-the-counter items or utility payments. By the end of the year, they have lost $1,200 or more that was sitting there waiting for them to use. Starting this year, these card programs have changed significantly. Before this year, they were more generous and easier to qualify for. Now you have to jump through more hoops, and for the most part, the values have been reduced. But they absolutely still exist despite the changes. Be very careful about how these cards are advertised, because some agents promote them in extremely misleading ways. But if your plan includes one of these cards, find out what it covers and use every single dollar before it expires. Check your vision benefits, including eye exams and glasses. Look into your fitness benefits because many plans include gym memberships and wellness programs. Post-discharge meals are covered by some plans after a hospital stay. And then there is dental, which is a huge one. Here is a strategy for dental work that can save you thousands of dollars. If you need $4,000 worth of dental work done, but your plan only covers $2,000 per year, split the work across 2 plan years. Go to your dentist and tell them you have $2,000 in coverage this year, so let us do half the work now. Maybe you do the bottom teeth this year. Then January 1st, when the plan renews and your dental benefits reset, you go back and do the top teeth with the new year's $2,000 benefit. You have now gotten $4,000 of dental work completed using 2 years of benefits strategically. Work with your dentist to plan this out because they understand insurance timelines and they will help you schedule things properly. Transportation to medical appointments is another benefit many plans offer that people completely forget about. If you need a ride to the doctor, check if your plan covers it. In-home support services are also available through some Medicare Advantage plans. All of these are benefits you are paying for through those monthly government payments to your insurance company, so use them. Now here is what might be the single most important message of this entire video. You have to fight back. The system is being deliberately designed to make it harder and harder for people to access and keep their benefits. Whether it is Social Security, Medicare, Medicaid, SNAP benefits, or Medicare Advantage plans, they are making the process more confusing, more time-consuming, and more frustrating on purpose. They reluctantly give you the benefits you already paid for, and then they make it incredibly difficult for you to keep those benefits going because they know that if they make it hard enough, a lot of people will just give up. Many people do give up. But you are not going to be one of them. You are going to keep fighting until you get what is yours. Here is a trick that hospitals play that costs people thousands of dollars. When you go to the hospital and stay for 1 night, 2 nights, or even 3 nights, you naturally assume you have been admitted. But there is a huge difference between being admitted as an inpatient and being held under observation. Many people stay in the hospital for 48 hours or more and are never technically admitted. They were classified as observation status the entire time. This distinction makes an enormous difference in what Medicare covers and what you end up paying out of pocket. So every single time you go to a hospital, ask specifically whether you are being admitted or whether you are under observation. Do not assume that staying overnight means you were admitted, because that assumption can cost you thousands of dollars in unexpected bills. When claims are denied, know that you have multiple levels of appeals available to you. A denial is not the final word. There are different levels of the appeals process, and many claims that are initially denied end up being approved when people actually fight back. Insurance companies deny claims knowing that most people will simply accept it and walk away. Do not be one of those people. Appeal every denial that you believe is unjust. Verifying that your doctor is in network is more important now than it has ever been. States are going to be receiving hundreds of billions of dollars less in funding this year. That means states will be cutting doctors from networks and reducing hospital coverage because they simply do not have the money. Doctors who accepted certain insurance before will stop accepting it. Finding in-network providers is going to become significantly more difficult going forward. Always verify directly with your doctor's office that they still accept your specific plan, because networks are constantly changing. Remember that emergency care is always covered regardless of your plan and regardless of network status. If you have an emergency, get care immediately and do not worry about whether you are in or out of network. Emergency coverage is guaranteed by law. There was a recent situation where Medicare had ghost networks on their official website. People went to Medicare.gov, checked to see if their doctor was in a particular plan's network, and the official site confirmed that yes, the doctor was in network. People enrolled in plans based on that official government information, only to discover that the doctor was never actually in that network at all. Medicare had to create a special enrollment period to let those people switch plans because the government's own website gave them inaccurate information. This shows that you cannot trust even official sources blindly. Always double-check directly with your healthcare providers. There are several circumstances that allow you to change your plan outside of the regular October enrollment period. If you move to a new area, if you gain or lose Medicare eligibility, if your extra help status changes, if your plan loses its Medicare contract, or if a 5-star rated plan becomes available in your area, you may qualify for a special enrollment period. Most people make changes during the annual enrollment period in October, but you might have a qualifying circumstance that lets you switch earlier. Reach out to a knowledgeable Medicare advisor to find out if you qualify. Prior authorizations are one of the two biggest challenges with Medicare Advantage plans. The two hurdles you face are networks and prior authorizations. With networks, the question is whether your doctor is in network today and whether they will still be in network tomorrow, because that can change at any time. With prior authorizations, here is the problem. Your doctor examines you, runs tests, and determines that you need a specific treatment or procedure. If you are on original Medicare with a supplement, that is the end of the conversation. Your doctor says you need it and you get it. But with a Medicare Advantage plan, your doctor has to ask permission from the insurance company before providing that treatment. The company then decides whether they want to spend money on your care, and far too often they say no. Then you have to go through the entire appeals process to fight for care that your own doctor said you need. This is a system where a corporation's financial interests can override your doctor's medical judgment. If you need help navigating any of this, finding the right prescriptions, finding a new doctor, dealing with billing issues, fighting prior authorization denials, or figuring out when you can switch plans, reach out to a qualified Medicare advisor who can assist you throughout the entire year. Getting signed up for a plan is just the beginning. The real challenge is making sure you get everything out of that plan over the next 12 months. A good advisor does not just enroll you and disappear. They help you when you lose a doctor, when you get confusing bills, when claims are denied, and when you need to figure out your options. One more important thing. If you are receiving Social Security retirement benefits and you are still working, you need to know the current earnings limit. If you are under your full retirement age, the earnings limit for this year is $24,480. Last year, it was $23,400, so it has increased slightly. As long as your earnings stay under $24,480, your Social Security benefits will not be reduced. However, once you reach your full retirement age, the earnings limit disappears completely. You can earn any amount of money, and it will not affect your Social Security benefits at all. Many people get confused about this because the limit changes every year, so make sure you are looking at the current year's number. Take all of this information and put it to work for you. Save it, print it, share it with everyone you know who is on Medicare. You paid for every bit of what this system offers. You paid through decades of payroll taxes, you pay through monthly premiums, and you pay through general taxes. Do not leave a single dollar or a single benefit on the table. Fight for what is yours. Use every benefit before December 31st. Plan your dental and medical work strategically across plan years. Check every card and every benefit your plan offers, and never accept a claim denial as final. You paid for the steak, so do not let anyone hand you a hot dog. Like this video, share it with someone who needs to hear it, and subscribe for more information that will help you protect your benefits and get everything you have earned. SSA Insights Pro.